You need to process trauma. You need to
Yep.
learn new ways to think, new tools to manage stress. So that's all really critical.
So many women are struggling with anxiety, with depression, and they go to their doctor, and I think it's often not given the emphasis and the importance that it deserves. These changes in our mental health are affecting our relationships. They're affecting the way that we show up in life. We're not able to be happy and to accomplish the things we want to because our brains are getting in the way. And oftentimes, the only tools we're told to try are antidepressants or therapy, both of which can be really helpful. But our guest today is a board certified psychiatrist turned functional, nutritional, and metabolic psychiatrist who is going to blow our toolbox wide open. She's going to help us fill our toolbox with different tools we can try so we can finally feel better, so we can feel happy, so we can get rid of that anxiety, so we can get rid of that depression. She's helping us look at the brain and how to decrease inflammation in the brain so that it works as well as it should. We talk about 3 things that are really going to dive in and help us improve our brain health. Nutrition, specific nutrients that we need to look for, have tested, and be aware of. Looking at effects of outside toxins that may be causing dysfunction in the brain. And we're also going to look at lifestyle measures that you can start right now to really support brain health and brain inflammation. You will find that when you start putting these steps into place, that your brain will work better.
The brain is the hardware, right? And when you're working on new ways of thinking, that's the software, and both are really critical. And
Yeah.
if you don't have the hardware that's working right, it doesn't matter if you upgrade the software.
Tracy, thank you so much for being here.
And it's my pleasure. Thank you so much for having me.
Tracy McCarthy is the creator of the Natural Mood Solution online program and founder and medical director of Dr. Tracy McCarthy Functional Medicine. She helps adults as they are battling depression, anxiety, brain fog, fatigue, digestive issues, hormone imbalances, the whole shebang. So we are so excited to have you here and to pick your brain and let you educate us on how to take care of our brains.
I'm excited to get started.
Wonderful. Well, I want to hear first a little bit about your journey because you were trained as a conventional psychiatrist and now consider yourself to be a functional, metabolic, and nutritional psychiatrist. So tell us a little bit about maybe your journey as a conventional psychiatrist and what was it that led you to pursue these other avenues of being able to support people in their health?
Sure. Yeah, I'm definitely in a place I would have never guessed before I went into medical school or even
Interesting.
during medical school. I had a very conventional education in medical school. And I went to medical school to really understand what goes wrong with the body. How can we help that? Very excited about the science and understanding this. And the first few years of medical school were pretty great for me that way. I really enjoyed being back in school and learning that. But as my training progressed, and you know this because you have the same kind of training, it becomes more and more about really labeling the pattern that we see with the diagnosis, which has of course, its role, but
Mm-hmm.
and then matching that very often to a pill for an
Mm-hmm.
ill. And
Mm-hmm.
this pharmaceutical sort of um, model that we've been in for the last century, I would say, became pretty frustrating to me because I felt like I didn't get to answer the question anymore. Why does this person have this
Mm-hmm.
symptom or this diagnosis? I would ask and always be told, well, we don't know. We don't know what causes schizophrenia. And then it was the end of the story, for example. And then I'm just left managing, well, which medication is best for them. And of course, again, there's a role for that. And it was very helpful to acutely stabilize somebody. But, then patients are asking me, am I going to be on this medication forever? Or it's only treated part of my symptoms. And I have a lot of really bad side effects, in some cases. So it was dissatisfying to have that sort of limited toolbox. And fortunately, around the time that I became increasingly frustrated with this, I stumbled upon the research on the role of chronic inflammation and how it can manifest in so many ways, and really went down the rabbit hole, which led me to the Institute for Functional Medicine and training with them. And along the way, I started to change how I ate and lifestyle changes. And my husband started changing how he ate, and we felt different and better. I'm like, wow,
Mm-hmm.
how come I never learned this in medical school? Which was
Mm-hmm.
frustrating. And, as I trained, I realized if I wanted to help patients this way, I really needed to step outside of what I was doing. At that point, I was an inpatient psychiatrist, meaning I
Oh,
was
wow.
working with hospitalized medical, mental health patients who are going through a crisis, and I wasn't able to apply this kind of what I was learning in that environment. So I began a practice, and I started, with the basics, helping people with their food and these lifestyle changes, and started seeing results. And then, as I kept training, I added in gut treatment, and then started working with hormones, started working with, removing toxins from their body, and just seeing these profound increasing results. And that led me to where I am today, that I'm so grateful to be here, where I've had my mind opened about what causes illness, and always learning more about that, and getting to partner with my patients and be a guide for them, and then watch them be empowered and take action and get better. And
Yeah.
it's just so fun, honestly. And it's so why I went into medicine. So I'm very grateful to be at this point.
Well, we're grateful you're at this point because we need more of you.
Yeah, we don't have enough folks doing this. That's true. And
Yeah.
you mentioned about the metabolic and nutritional psychiatry. These
Yeah,
terms,
exactly.
I'm happy to see these terms coming into be being more common. Nutritional psychiatry is really this awareness, and there's psychiatrists who practice knowing that, hey, nutrition matters, which should be fundamental, but really isn't. Is not taught, and they're recognizing the role of B vitamins and minerals like zinc and magnesium and omega 3s, and really making sure they're talking to their patients about this. They're really looking at they're helping them remove the processed inflammatory foods from their diet. So this is a great step if practitioners are doing that, they're already doing a lot more than the conventional model. Metabolic psychiatry is sort of a newer term, very exciting, because this is really focusing on the role of insulin resistance. I know you've had a guest recently talking about insulin
Yeah, yeah.
resistance. It's a big deal for the brain too. And there's some very exciting research that's been coming out in recent years about, for example, a ketogenic diet in bipolar disorder and other serious mental illness. It's really a game changer in the role of mitochondrial function. And so metabolic psychiatry is really looking at that. Functional medicine psychiatry incorporates all of that, but then goes farther, really, really looking at gut health, recognizing the role of toxins like mold or heavy metals, really understanding the role of the nervous system, and just so many pieces, looking at all of that we know matters.
Thank you for explaining that. Take it a step further, if you will, and explain to us a little bit of your conversion because, as functionally trained or as conventionally trained physicians, I'm sure you and I have both had that same experience of like, ooh, I don't want to say toxins. I don't want to say, like, I'm not one of those doctors. And I can tell with my own experience that I was kind of like, do I believe in mold? Do I believe in toxins? And then you start seeing people get better. What has been your experience with sort of that conversion of things that we're not necessarily trained on in medical school or still aren't always completely accepted as the bread and butter of conventional medicine?
Oh, yeah.
What converted you to that?
Well, I think my original conversion and sort of what opened my mind really was about metabolic health.
Mm-hmm.
It was really around insulin resistance, and seeing that people were having success, for example, with a low carb diet and reducing their level of insulin and, controlling their blood sugar by doing that. And that, I had just never learned that. And it seemed so obvious once I started
Mm-hmm.
reading about that. Like, well, why on earth, like I remember learning about with diabetes, well, you just count the carbs and then you adjust the insulin, end of
Yep.
story. Like, well, maybe
Yep.
it would be better if they could use less insulin because there's impacts from that insulin. That was
Yep.
never discussed.
Mm-hmm.
And, this was, I can't, there was a few books I read that really changed my life. One was Good Calories, Bad Calories by Gary Taubes. And that really helped debunk the heart health diet hypothesis, and Ansel Keys's 13 country study that is so flawed, and realizing like this whole thing about being scared of fat and fat causing everything, this is wrong.
Mm-hmm.
And that was really pretty upsetting almost to me, because I had this sort of blind faith in my education. I was very naive, and I thought I was going to learn everything I needed to know in medical school to help people. I mean, I laugh now because that's a ridiculous idea that you could learn that anywhere, really. But
Yeah.
I was very disillusioned, and I was kind of angry because I thought, there's a lot of fundamental stuff here that I could have been taught that's in the literature about
Mm-hmm.
inflammation, about nutrition. It's, the science is there. So that was, the sort of the scales fell from my eyes kind of and cracked my mind open. And I was pretty comfortable talking about those kind of things. And it was only through the functional medicine training that I really learned about the role of toxins and, and the way detoxification is taught there. It's, I was like, oh yeah, I learned this in medical school, phase
Yeah.
one, phase two, liver detoxification. This is biochemistry. It's not some woo woo detox thing. It's a
Yep.
real thing that's happening in the body all the time.
Yep.
So that's how I would talk about it with patients. This is like everyday, um, you know, cleaning up in the body that has to happen. Mold was an interesting one, though. I got some really great mentorship early on in my functional medicine career. And so I learned about mold really early on, and I was trying to work with people on it. And I remember thinking, this is just too hard. I think I'm not going to focus on mold. I'm just going to work on people's gut. And
Yep.
I get that. I'd gone down that way and I thought this is too much. And then it was just staring me in the face,
Yep.
patient after patient. And I was like, okay, I'm getting the message. If I don't work on the mold, they're not going to get better. It is so common. It's shocking how common mold exposure is.
Yeah.
With like 48% of buildings with water damage, according to the EPA, people are getting exposed a lot and some people are very vulnerable. So,
Yep.
you know, so there was that part where I really tried to deny that I needed to work on that. And that's kind of been the journey, and now I'm just so far from living in the conventional, model. It's okay for me to talk about all this because I'm talking about it with my patients. I'm really rarely talking about it with peers.
Yeah.
That would be harder.
Yeah. Yeah. I think that you just described my own journey as well of sort of like, no, I'm not going to do that. I'm just going to focus on this part. And then you get more and more patients and they have more and more needs. And then you
Mhm.
realize they need help and that we don't have those answers in the conventional model. And then you say, well, this is safe. And this is, we
Mhm.
could try this. And then you see it work and then you see it work again. And then you're like, oh, well, this
Right?
is what I do now.
And are you grateful that you have that open
I'm
mind? If
so
you didn't
grateful.
have that, you wouldn't be
Yes.
helping these people, and they're so
Yeah.
stuck. I mean, you must be like me where people come and they are stuck,
Yeah.
and they have been banging their heads against the wall with the conventional model, and they're told, "Oh, your labs are normal," because 'cause they've gotten this, like, silly little lab panel, and that's it. And, sometimes really gaslit, like, "This is in
Mm-hmm.
your head, you're fine," and they know they're not fine, and they're not fine.
Yeah.
And so, I feel like my number one job is to see the patient, validate them,
100%.
and that right there is where the healing starts.
Yeah. Well, and I feel like as you start going off of the conventional path, the wonderful thing as a physician is like, I don't have to get rid of my conventional tools. I just open my tool bag and I start shoving all the tools in, every tool I can find. And then I can really talk to the patient and say, listen, depending on where you're at, we can try conventional tools. We can try kind of middle of the road tools. We can try way off the beaten path tools if that's what you want and it's safe. And, so it's really a pleasure as a practitioner to be able to help customize that approach
That's
using
exactly
whichever tool feels right at the time.
that's exactly how I like to talk about it. I'm like, I just have a much bigger toolbox, and I'm
Yeah,
so happy to have that, and I keep adding to it. And yeah, we don't throw the baby out with the bathwater. There was
yep,
important, useful things from my
100%.
conventional training that I do still use. And, there's a role for it. And it's just
Yeah.
about having that judgment and discernment. And like you say, what does the patient, want? What is going to work with them?
Well, so dive in a little bit and tell us about we'll kind of skip to the end and then we'll kind of fill in the gaps here. I want to hear about the successes that you're seeing because I think for anyone who's struggled with mental health illness a little bit, or for someone who's struggled chronically of it's really affected their life, maybe they haven't been able to maintain a marriage or keep a job or, some of these really severe effects on our lives. It can be tempting to think, well, I mean, what's she going to do? Make me feel like 10% better? Like
Mm.
maybe I'll have a few better days. What are the successes that you're actually seeing? Can you give us an idea of what's possible?
Yeah, let me give you kind of a little bit of a smattering of examples.
Yeah.
Because it can range from it's not too many things we need to do to there's a lot, or it's a more severe, complicated, I should say,
Yeah.
case. But there's so much hope. I mean, it can be as simple as a patient came to me and had already been helped a lot with someone who'd worked with her hormones, and she'd had, her thyroid had been optimized. She had insulin resistance, was on metformin and really benefiting from that medication, and had done so well, but now was having this depression. And it felt really odd to her. She hadn't struggled with depression before. And in her case, it was honestly as simple as vitamin B12 because she'd been on metformin now for a year and nobody had told her that she needed to supplement with B12 while on metformin. And that alone made the change. Now, I would stress that that's unusual, that it's one.
Yeah.
Of course,
We
as
love
we
it when
do
it's like that.
yeah, right. I was like, I mean, it was a quick win for, her to have immediate like lifting of her mood in a couple of weeks. However, with her working together, we did find there were other issues and went deeper that for her overall health, like how'd she get that insulin resistance
Mm-hmm.
anyways? Why was her thyroid not working? But for her mood, that B12 was key. Um, Sometimes it's really about blood sugar. I had a patient who had very lifelong chronic anxiety, had been to like an anxiety day treatment program multiple times,
Wow.
pretty intensive. When she cut sugar out and started monitoring her blood sugar, but it was really especially just sugar, her anxiety swings totally disappeared.
Hmm.
And it's not always that simple either, that it's just that, but it was dramatic. We also see a lot of people's insomnia clear up when we stabilize blood sugar. So
Mm-hmm.
those are kind of more simple examples. One of my first mold cases, the patient had a lot of, she was a very young woman with panic and depression as well, but a lot of anxiety, almost to the point of agoraphobia. So kind of scared to go out. And when we cleaned up the mold and got it out of her system, these symptoms went away. And now
Hmm.
she's functioning well. I've seen so many of my patients who had things they wanted to do that they couldn't do. And then, I find out she's graduated from her, graduate program. Now she has a career. Oh, this patient, is no longer homebound and is like dating and now they're engaged. These are the things that
Oh,
make
it's
me so happy. Or the
amazing.
patient who just 2 weeks ago had a baby that could not for so long because of all the toxic issues and the gut issues. So, these are exciting. One of my earlier cases also that really I'll just never forget, which I think is a great sort of classic example of functional medicine. She came to me with irritable bowel syndrome. So she had diarrhea all the time, and she also had anxiety. And she was on Lexapro to help with her anxiety. And she stayed on it because it had helped some, but she still really had a lot of anxiety and still had some panic. She used to love to travel and she could not fly anymore because the anxiety and the irritable bowel syndrome, she never knew when she was going to need a bathroom. So her life had just shrunk,
Mm-hmm.
And when we worked together, we worked on, she had a yeast overgrowth in her gut. She had some hormonal imbalances. She needed some nutritional work. And, we just worked on the pieces and it didn't take very long. In several months, she was done with the irritable bowel syndrome. She had normal gut function. Her anxiety had gone away. She told me she was taking flights with her grandson. And it was just like she was living her life, which is the goal. And, no med is going to do all those things. You have to
Mm-hmm.
look at the root causes. So those are some examples of cases that are not unusual at all. And there's even more extreme cases like a patient with a psychosis, schizophrenia, where, there's a big role in this case for gluten causing an issue, working on the metabolic part of it, but also these immune triggers have made a huge difference in her symptoms.
Well, I love that. It just wets our whistles for what's coming next because now we want to know like, okay, how do we do this? What's actually involved? But it is really nice to hear. When I think of mental health issues, I think of I call it brain inflammation because I think there's so much of an expectation in society of what it means to have a mental health disorder. It's so taboo and less so maybe in recent years, but the idea of it being a medical issue, right? That it's not something that you are a flawed human being. Like this is literally the neurons and the neurotransmitters in your brain are possibly not optimized. And that when you optimize them, then it really does affect our thoughts and emotions. And that's a tricky link for a lot of us. We think like, no, you should just think differently. You should just not be so depressed. And to actually feel like, okay, this is just like if my wrist hurts and I think I find out I have tendonitis. If your mood is off, it could be that you have brain inflammation, and really just changing that paradigm is so valuable and really gives us more tools, as you mentioned, instead of just therapy and antidepressants, both of which are great.
That's right.
I'm very glad both of them exist. And I think therapy especially plays a really big role because you have to retrain sometimes how your brain is actually thinking, even once the inflammation is down. But to think that it's only about therapy can feel like you're hitting your head against a wall because they keep telling you how to, use different tools to think differently. And you're like, my brain's not doing it. And really to be able to decrease the inflammation so it's so much more receptive to that, it can be such a lifeline for people.
Yeah, you hit on so many important points there. Like, the brain is the hardware, right? And when you're working on new ways of thinking, that's the software, and both are really critical. And
Yeah.
if you don't have the hardware that's working right, it doesn't matter if you upgrade the software. But you do have to upgrade the software. If you need to process trauma, you need to
Yeah.
learn new ways to think, new tools to manage stress. So that's all really critical. But yeah, that hardware, if it's not functioning well, and that's just it. Inflammation is at the root of so much of this, and you were right to call it brain inflammation. I think some of this disconnect, I mean, it comes from this idea that the brain is somehow not part of the body. I mean, it's
Yes.
ridiculous, right?
Hmm.
But that's kind of, conventional medicine is very much siloed. You've got your gastroenterologist, you've got your neurologist, your cardiologist. And I mean, it's funny that there's even a neurologist and a psychiatrist, right? But
Exactly.
I guess it's supposed to be kind of brain and mind, but it's just totally artificial. And this separatism is really part of the big problem, and not looking at the body as a whole. And I think that's part of where we get into this issue of people just not thinking that what's going on in their brain might be part of, partly due to what's going on in the body. And it's funny to me now that that's a new way of thinking. But I remember when I first was learning functional medicine, and I really was asking, like, does this work for mental health too? Or is this
Hmm.
only for autoimmune conditions and gut issues that I've been seeing? And, I didn't have a lot of examples of practitioners to look at who were doing it. But once I
Hmm.
found one or two, I was like, okay, yeah. And now, of course, I laugh because we realize in functional medicine that everything causes everything. So,
Hmm.
of course,
Yeah.
the brain is helped by these things. And now I've got years of examples of people getting better.
Well, so let's dive into that a little more. As a conventional psychiatrist, the convention, like you mentioned, to diagnose it's pretty intense, right? The diagnostic guide for psychiatry is constantly changing, and it's the Bible, right, of psychiatry. And we don't have that as much in OBGYN. I mean, we do have some diagnostic things around endometriosis and PCOS and PMDD. We have some of this, but psychiatry is another level. You have your diagnoses, and the conventional psychiatric world really wants to figure out, what diagnosis do you have? Is it major depression? Is it bipolar? Is it anxiety? Is it schizoaffective, right? Like, there's all of these things, and you are piecing them about and then oftentimes giving people more than one diagnosis. How much do you still find that in your practice now? Because it seems like in my practice, it's more like, well, I don't care which bucket you fall in. Like, let's just make you feel better and see which symptoms go away. Has that been your experience, or will you share about that?
Yeah, my experience is totally like that. I do care what the diagnosis is,
Sure.
but not in the way that I used to. So I think,
Mm-hmm.
why does that matter so much in psychiatry? Well, a large part of it is about understanding which treatments are going to work best. So when you understand this is bipolar, for example, and not schizophrenia, then it may influence, your choice of medication.
Mm-hmm.
But that's kind of the limit of that. For me, I'm really always thinking about root causes.
Mm-hmm.
And, the thing that's really important to understand, that your listeners have probably heard you talk about, is that you can have a lot of different root causes, and they're going to show up as different symptoms in different people based on their genetics and their
Mm-hmm.
exposures and who they are. And so it isn't so much about that. I mean, we do know certain things, and sometimes the diagnosis is a hint to me about some of what's going on, but really, like, you take 10 people's depression and they're not caused by the same thing. There are
Yeah.
different clusters of causes in each of those people. So I have to look at that level to get the results. And all of these diagnoses, these are symptoms. They're
Mm-hmm.
the result of whatever's driving it.
Mm-hmm.
So that is how I think and I've definitely encountered some patients who are really focused on their diagnosis. I mean, I've noticed this in particular with autoimmunity. Like, well, I really want to know which autoimmune disease I have. And, unfortunately for people suffering with autoimmune disease, often they go 10 years before they get a diagnosis.
Mm-hmm.
And then they finally get the diagnosis. And, I'm like, I don't care if there's a diagnosis or not. You're having an attack on your own body, from your body. what's going on, what's driving that immune dysregulation.
Mhm.
That's what we're going to work on.
Mhm.
So I think we're on the same page about this, where it's like that's less interesting and less helpful.
Yeah. So tell us how you then approach a patient who comes to you with some sort of mental health or mood symptoms. Maybe just lay out for us some of those root causes, even if it's just categories of root causes. You mentioned in one of your examples nutrient deficiencies. So we know nutrient deficiencies are in there. Will you continue to build that list from there?
Sure, yeah. So nutrient deficiencies, just to expand first a little on that, whether it's the things are missing from the diet,
Mm-hmm.
or they're eating it, but they're not absorbing it. So
Mm-hmm.
that gut health is huge. Part of gut health is that assimilation, that digestion and absorption. And I see a lot of that not going well for people. I see a lot of fat malabsorption, for example. So addressing that aspect of gut function is really important. And then the gut microbiome, that's the other huge piece, right? What's happening there? And that's something to actually test for and look at, are there overgrowths? Are there deficiencies? Is there an infection even with a pathogen? Like, is there a parasite? What's happening? So that's another big area. Mitochondrial health, that's a big one. The functioning of like the ability for the cells to make energy. Some of that's based on nutrients, and some of that's about things like insulin resistance and toxins damaging the function of the mitochondria. Look at hormonal balance as you do. That's huge, huge for mental health. I see lots of women, for example, with low progesterone. I had one patient with obsessive compulsive disorder that really flared always in the second part of her cycle. And the thing that really helped her was progesterone, getting that balance. It just took it away. It was amazing. And so that's another big piece. And then we've talked about that toxic piece, which is kind
Mm-hmm.
of like the last step. I think probably a lot of practitioners approach it that way, where you got to work on the gut. You got to get the nutrients on board and get the building blocks there for the body to do the work. And then you can begin to look at starting to remove toxins, because you have to have a functioning gut to do that. You
Mm-hmm.
have to have functioning liver to do that. So
Mm-hmm.
that's kind of the last layer. But as you heal the different areas of imbalance, everything starts working better. And it's really like a feed forward cycle. And then naturally, they're going to start detoxification much better.
Mm-hmm. Okay. Comment, will you, as well, on the role of genetics here? We know that some psychiatric illness seems to have a genetic predisposition. Sometimes it's just common, right? Someone says, oh, I have a family member who has depression and I have depression. Is that genetic or is it just common? But then you do have some people who, like, every single member of the family suffers from anxiety. Help us understand the way that genetics plays a role there and how you use that to help people.
So genetics is a really great point to bring up. I think this is one of the myths I like to bust, is that people think this is their destiny, or they're doomed to have this because it runs in their family. And it's important to know that family history, because that's their, vulnerability. That's how their inflammation likely will show up, but it doesn't mean they have to have it. We think of genetics for most situations is like 10% of the issue. There's a phrase that it's a little violent, but the genetics loads the gun and the
Yeah.
environment pulls the trigger.
Mm-hmm.
Maybe a less violent metaphor for that. So it's important, but it is absolutely not everything. And so I always educate patients about that, and then talk about the concept of epigenetics, what's turning on and off those vulnerabilities, and that those are things that are so much under our influence. What we eat, our light exposure, our sleep, our movement, our relationships, all of these things. And so that's how I approach it, and that's how I work with it.
Hey there, listeners. Just a quick break to tell you about something that could make a big difference in your life or the life of a woman you care about. Here at Uplift for Her, we specialize in integrative women's health, offering comprehensive support for every stage of life. Whether you're navigating menopause and need expert HRT advice, looking to shed those stubborn pounds, or seeking for help with your mental well-being, we've got you covered. We combine the best of traditional and functional medicine with personalized health coaching and dietitian support here at our Salt Lake City-based clinic. We ensure that your unique needs are met with the care and expertise you deserve. At Uplift for Her, we're here to help you feel your best inside and out. Ready to take the next step in your health journey? Visit us at upliftforher.com or give us a call today. We have services available for those of you living in the state of Utah and some services available for those of you outside of Utah. Now let's get back to the episode. Now, what is your construct? How do you approach a patient then? I think a lot of functional medicine practitioners, we gather the history and then we start with maybe lifestyle, right? Let's make sure that you're sleeping and you're moving and you're eating well, and then maybe some lab work. Tell us kind of where you start and where that goes from there, and if it's unique in psychiatry, functional psychiatry, as opposed to other functional medicine or not.
I don't think the way I practice is different than general functional medicine because I found this to be just broadly helpful, this approach. So we begin, I work with patients in a program where they are having health coaching and nutrition coaching and brain retraining, which I'll talk about a little more as well. But so we do begin with those lifestyle changes, but we're doing testing immediately. And that's to get at some of the low hanging fruit, first of all, because, hey, if it is a low B12, for example, or something like that, we want to immediately start working on that and get people feeling better. And then they're even more able to implement lifestyle changes and to help them see where are the areas of imbalance that we're going to work on. Some of them are going to take time, but getting clear about that. Okay, we have a lot of work to do on the gut, or there's a toxin issue here. And then we also do this piece of brain retraining. And I think you alluded to that a little bit earlier about, we have to change the patterns because when people have been chronically struggling with illness, their brain is very much sort of in the mode of having those symptoms and trying to protect them from having, anything get worse. And when you heal the body and you take away those toxic threats and make things work better, you have to update the software in the brain that the situation actually is better because the brain's still just trying to protect you and it can generate more symptoms in the body if you don't change that. So it's really, really important to work on that from the beginning. Helps people with their tolerance of treatments if they're a sensitive patient, because we got to convince the brain that it's safe. It's going to be okay to do different, supplements and make changes. And it helps their brain, be more neuroplastic. That's our goal. That means that it's changeable. The brain can adapt. And often people's brains are just kind of in a stuck place. And so when we give the nutrients and lower the inflammation so that the hardware works better, we also update that software. Those are the parts that are important for neuroplasticity.
Let me just emphasize that because I think that's so key in all aspects of functional medicine, but especially when it comes to mental health in the brain, is the brain does get stuck in this fight or flight, right? So I call it saber-toothed tigers. But it's not just that our brain is stuck in fight or flight. This is a mistake I think a lot of people make when they're dealing with mental health is they say, oh, I need to retrain my brain not to overreact. And yes, that's what you're going to talk about with the brain retraining. But also it goes down deeper to the actual cells. The brain is the input. That's the programming. We don't have a lot of different programming. I mean, maybe if you have sensory on your skin or your fingers, but like most of the input we have telling our body what to do is based on our thoughts and our perception of the world. And so if our brain perceives the world as dangerous, that programs the cells to perceive the world as dangerous. It actually shifts them from like healing mode and from maintenance mode into military mode, into like soldier mode. And those cells staying locked on in soldier mode can make it really difficult to get better because the cells are actually rejecting any sort of supplement you try to give them, as you mentioned. So it really is a twofold approach is you have to get those cells to calm down and then you have to retrain the brain and then you have to get the cells calm down a little more and then you have to retrain the brain. Did I restate that okay?
Yeah, it really is iterative and they feed each other. So you have to calm that nervous system enough that the brain thinks things are safe enough that you can begin to get cells out of that state. Because it's true, like we don't detoxify when we are in fight or flight, like the biochemistry shifts and we have to send the signal of safety for things to happen. But we increasingly send the signal of safety back up to the brain from the body when things are going better. So they interact with each other and you do have to iterate on it like that. Yeah.
Tell us then more about brain retraining. How is that different than therapy or, thought work, or is it different? What actually are you doing in that component of the treatment?
Well, therapy, super important, can mean a lot of different things.
Yes.
And sometimes therapy ends up being, unfortunately, sometimes it really ends up being kind of walking the same paths, the same neural circuits, like telling the same story about the trauma that happened and not actually processing it. With the right kind of approach, it really is processed. And that's very, very important. But if you're just sort of repeating the same patterns, then nothing's changing. And so with brain retraining, there's several steps, but it's about, and there's different programs out there that do that, and they're all really great, but they have sort of shared components. There's things that are going to calm the nervous system, and then there's the part about visualizing and picturing things being different than they are. And it's almost like an exposure therapy. You're doing it stepwise. It has to be something you can believe, because otherwise you're just going to reject it and it won't work. But you're using your imagination to picture doing things that maybe right now you can't do. So let's take an example of someone who's extremely fatigued and they normally can't walk down the street to the mailbox. So maybe that's the thing they're first imagining in their mind doing. And the brain is so interesting. It doesn't really know the difference between what's real and what's imaginary. So if you
So
practice,
amazing.
this has been shown with athletes, right? They can imagine doing the lift, for example, of the weight, and they will actually gain muscle. Like, this is so cool what the brain can do. And the brain is running the physiology. So, you're using that brain practice to get the body to be able to come along and do more, and to help your brain realize, like, to help you realize, to expand what's doable for you, what's safe for you. Maybe it's like certain foods you haven't been able to eat, and then you sort of imagine that you can start to incorporate them and not have the same gut pain, for example. And so, and it's about changing your idea about what's possible. So there's different ways people approach this, but I think it's a really, really important part of healing. If you've had any kind of long-standing, and when I say that chronic, I mean like 6 months or more of a chronic symptoms, it's a game changer. It can help you feel better, especially with your mood, actually pretty quickly. And then helps your treatments go faster, and then helps them stick, helps you not regress.
So cool. So, what does this look like in your clinic? Is it one-on-one? Is it a digital program? Is it a meditation library? What does that look like for your
Yeah, we
clinic?
have a brain retraining coach who
Uh-huh.
does meet with patients, and it's part of our program that she teaches the foundations, and then there's a follow-up session where she's going deeper. Sometimes we do recommend people do a program like Primal Trust or Gupta program. Those are great. And then we also have an educational webinar library of resources on, our brain retraining coach and myself and our health coach and nutritionist talking about different subjects to educate people. And we'll refer them to these, like, please watch that one. And, those are resources we have.
Awesome. So, where does a patient start when they are struggling with mental health? Number one, is there something, are there some general rules that they could apply to get started before they ever see a doctor, or is it best to not? I mean, I don't think necessarily experimenting with something like keto is necessarily the way to go, but perhaps whole foods, or what are the types of things that you would say, yes, if you're struggling with anxiety, depression, postpartum depression, what are some things that they could do pretty generalizable?
Yeah, I love this question, because I think there's actually a lot people can do before they ever have to see someone like me. And I think your point about keto is also very important, because it's complex. It's really effective, but it's a therapeutic tool and should be done with supervision. But eating paleo, for example, or just clean whole foods diet, lower carb, that you can do very safely and have a lot of impact. And that's one of those things. So patients can start with these foundational lifestyle changes. So that would be anti-inflammatory diet. Just start with removing processed foods, and wherever you are on that spectrum, maybe that's just stopping drinking soda. Maybe it's not going to fast food restaurants anymore, and it's like always baby stepping your way forward. So the anti-inflammatory diet, really important, getting in the nutrients, making sure you're getting some basic, potentially basic supplementation, unless you're eating a very nutrient dense diet. So B vitamins are critical for mental health. That includes folate from dark leafy greens. It includes B12 from animal products. and the other B vitamins. Those are all really important. Zinc, magnesium, these are things we see very low in mental health conditions that people often benefit from adding. You can get these from foods. Some people need to supplement as well. Omega-3 fats, I almost didn't say that one. That's so critical. Anti-inflammatory, the brain needs these desperately. And most people have just hardly any, and they have a high level of omega-6 fats, the inflammatory fats from all our processed oils, and that's a real problem. So even just doing those kinds of things makes a huge difference. And that's where I would begin. And then things like light exposure, getting light in the morning and making sure that you aren't exposed to a lot of light right before bed, like not looking at screens that are going to tell your brain it's morning when it's nighttime. These things are basic sounding, but they make a huge difference. And I think starting there is important. I think that, there's a lot of things available. There's great books out there. There's courses. There's things you can do on your own. And then you see how far you get. And then if you get to where you feel like you've done a lot of these things, you've definitely had improvements, but there's some things that are stuck, that's when I would start thinking about seeing a practitioner.
That's really helpful. One thing that I do see come up for patients is, I tried that. Nope, I tried that. Nope, I tried that. And I think it's really important to recognize that most of these things in the brain, really, and in what we do in functional medicine, it's very multifactorial. And so if you try a B vitamin on its own, sometimes you don't feel anything. And then you try zinc on its own and you're like, well, that didn't do anything. And sometimes it is kind of looking at that whole lifestyle piece and saying, okay, we really want to, it's a tricky balance between when I take care of my patients, I want to help them with baby steps. I don't want to overwhelm them. I don't want to do too much. And at the same time, sometimes we have to do more than one thing before we really see the results. Yeah. So just a note on that, because I think that comes up for people of like, I tried that. It didn't work for me.
Yeah. I tell people a lot this term, which is from my education in the past, which is something is necessary but not sufficient.
Yes.
And everybody has multiple things that they need to do, and you don't do them all overnight. So you're building a foundation, and hopefully some of those are things you're going to feel a difference from, but you might need to do a bunch of things before you really feel a difference. But I think when people can be, when they start to learn what are these imbalances and what's going on, then they start to grasp that, okay, it's going to take multiple things, and they're okay with that. And yeah, it's a dance, isn't it, with a patient where it's like, we have to do enough things that they feel a difference. But if it's too many things and they're overwhelmed, then they're not going to do anything and they're going to feel terrible about themselves. And we don't want that at all. So it is about, and this is why it's so important, I think, to get the support of somebody as you work on this, whether it's your coach or therapist or your partner, or it's their functional medicine practitioner, that you are someone showing you, helping you look back and go, remember where you were before? Remember when you were eating all the fast food? Like, you've come really far. And what's the next step now that those things are easy for you? What's the next step to incorporate?
Yes, I want to emphasize that idea of having some way to measure your progress is so important, because it's really easy to lose motivation if you're not 100% better. Because the whole thing is that as our mental health is troubled, it's really difficult to get a perfectly accurate perspective on what's going on. And I say that as, I've had my own mental health struggles in the past. And so I call it lenses, where you can't even see the world. You can't tell what lenses are on. That's just what the world looks like. And it's only when the lenses come off that you really get an accurate view of like, oh, I was really depressed. Like, I was not seeing that accurately. And so having some way to track your progress along those lines, where you can have that motivation to say, I have made quite a bit of improvement. I'm not there yet, but I've made quite a bit of improvement. And I agree with you. That's one of the things that I find most beneficial of meeting with my patients, is me saying, how are you doing? And they have to really stop and think of like, oh, I noticed this is better. I also will sometimes read the notes that I wrote their last visit and say, you said that this was going on, or you said that you could hardly get out of bed. Is that better? And that sometimes will trigger them to say like, oh yeah, I forgot that was going on. Didn't even remember that that's how bad I was.
So the negativity bias is a big issue that we're all fighting against. It's there to help us, keep us alive, but it also can make us very unhappy and make us think we're not making any progress. So some of the things that I think help me personally with this and help my patients is writing our wins each night or each morning, like 3 things that I got, that happened that are successes, and really taking a little bit of time to savor that, because it helps us remember, like, oh, I am getting stuff done. I am making progress. Another one is like with my patients, I do the same thing. I'm always following up on the last note. Well, how are these things? But sometimes it's helpful to show them, their symptom score that they had at the
Yes.
beginning. It's like,
Yeah.
well, you were 120 on our medical symptom score. That's a lot. And now you're at 60. So that's still like 60 is lots of issues, right? And of course, you want to keep working on those. They want to keep working on it. But hey, you've got cut in half. That's
Right.
amazing.
Right.
And it shows you what's possible.
Yeah.
I have a patient right now who really does struggle with this. And she's like, I'm never going to get better. I just think, it's not possible for me. And I'm like, well, do you remember when we started working together a year ago and you had all these problems? And a whole bunch of those are actually gone. And that shows you that change is possible. And as soon as we
Mhm.
talk, she's always like, oh, that's right. Oh, yes. Okay. I always feel better after we talk. But
Yeah.
it's our brain. Our brain is always just kind of a little bit fighting,
Doesn't like change.
no, and it means so well, right? It's
Yeah.
trying to protect us, but that negativity thing really can make us unhappy.
Yeah. Yeah. Such important aspects of this. So maybe tell us next, what are the major tests that you do when someone comes in, maybe with more advanced mental health concerns? I mean, if someone has a couple months of anxiety, then we may think more like your patient of like the insulin resistance or the B12 deficiency or something like that. But when someone comes in with long-standing mental health issues, what are your go-to lab tests that you find most critical in really helping them uncover what's going on? I know there's a wide array, so
Yeah, I
the ones
start
that come to
with
mind.
kind of 3 batteries of tests always, as a foundation. And I would say that all my mental health patients also have other issues. Like this is, of
It's not
course,
their
right?
only symptom.
Yeah, exactly. They've
Yeah.
got issues or pain issues or something. So Um, I start with a very comprehensive blood test that looks at all kinds of hormones, sex hormones, thyroid, insulin, cortisol, nutritional factors, inflammatory factors. So that's very important. And then I also do a comprehensive stool test that is looking at digestion, inflammation in the gut, microbiome, infection. That's very important. And then I do a urinary organic acids test as well, which is another window into the gut and catches things that the stool test does not. I find the organic acid is pretty helpful to look for fungal issues and hints about mold issues, and also more nutritional status in that test, and also some information about detox pathways and neurotransmitters and mitochondria. So I find that a really great place to start. And then I might go down some other paths after that. Like maybe I don't want to just have serum hormones. Maybe I want to do a urine test to look at the metabolites of the hormones, how they're
Hmm.
processing that. Is it down healthy pathways with their estrogen or not? I will consider doing urine and testing for mold toxins in some
Hmm.
cases. Those are probably the next 2 most common tests I will do. Um, I'm adding some genetics testing actually now that there's been a leap forward with the genetics testing that makes me interested in it again, because it used to feel like a rabbit hole that didn't really help anybody actually feel better.
Hmm.
But I am doing some advanced genetics work now that I think can help certain cases. So,
Hmm.
always looking at new things and seeing
Yeah.
what's going to help.
One question that comes up a lot with some of my patients is like a hair mineral analysis test. Do you use that much to look for metals or minerals?
I don't much. It is an option for sure. It can be a way to assess, certain toxin like metal exposures, like you
Hmm.
mentioned. I don't tend to find that necessary, I guess I would
Yeah.
say.
Yeah. Yeah. That's good to know. Okay, so you're kind of taking a patient comes in, you're definitely looking at their lifestyle, you're definitely looking at this wide array of tests. And I think this is important for people to understand because I think as patients, we are used to the conventional medical model of you're going to get 20 minutes with your doctor, they're going to give you a diagnosis, they're going to give you a pill. And honestly, there are times when I miss that style of medicine where it's like that was so easy. I just met
Or
with them, I
very
knew
easy.
exactly what they needed, I gave them their stuff and they went on their way, whether they felt better or not, but they went on their way. But I mean, I joke because it was simpler,
No, you're
but
right.
but
What we
we
do
have
is
to.
complex.
It's very complex, and we have to understand that as practitioners, as physicians, but as patients, we also need to understand that, because I think the idea of hope is 100% there. There are so many things that we can do to feel better and to improve our lives and to improve our life expectancy and to
Mhm.
manage chronic disease and go on and on. But what we do in functional medicine is involved, and it really involves looking not at everything, every tiny little, like it's not millions of things, but it's like 5 to 10 big categories of things. And
That's
I
right.
think as patients, we want to come in with that expectation of like, okay, I am going to have to really dive into a few different categories of things, but I am going to get better. And just having that expectation can be helpful. Do you give any sort of expectation of time frame of what people can expect?
Yeah, I mean, it does, of course, vary, but I think we really work hard to set expectations even before people are patients. There's education kind of in the process of becoming a patient to help people understand what you were talking about right there, which is, there's a lot of pieces that are going to be done, but often people are pretty excited about that because they want someone to look at the whole view because nobody
Yeah.
has been.
Yeah.
But also that, there's a time commitment, and you have to step up in your own commitment to yourself to
Yeah.
do this work. And so, we have an initial program that's 6 months, and people get lots and lots of gains in that time. But, a mold toxicity issue is not going to be resolved in 6 months. But that doesn't mean they're not going to be well on their way and feeling a lot better.
Yeah.
So, depending on what the issue is, I'm going to adjust those expectations with people about, what it might take. And it's, of course, their level of engagement really dictates that rate of progress as well.
Yeah. I just want there to be accurate expectations, because it's so valuable. It's such a valuable set of tools that we have. And I wish it was simpler. Like I wish it was just super, super easy. And it's not. It's not. But man, it can change whole lives. I mean, absolutely, it can change lives.
Yeah, we both see that all the time. But
Yeah,
I do
for
think
sure.
I hear what you're saying, because I think before I worked with people in a program,
Yeah.
that's part of the problem. I think is people have to be ready to make that kind of commitment.
Yep.
And that's when they see the results. And
Yep.
I would joke sometimes people want me to wave my magic green wand, to fix things. That's not a pill. It's like, well, this is actually work.
Yeah.
It's going to take a lot of work on your part and a lot of steps, but it's also going to feel really good to accomplish that
Yeah.
and to be empowered and to see that you made yourself better.
And I think you learn so much. That's the other part of, I think, this big paradigm shift is when the human world was simpler, that we were cave people. You didn't need to know that much because everything was reflexive and there wasn't much sort of quote unquote poisoning our health, right? I mean, you got
Mhm.
up, you went and hunted for something, and hopefully you didn't fall off a cliff or get eaten by a tiger, and you did okay because your body was interacting with its environment the way that it was meant to. And
Right.
ours is not that way anymore. And so fortunately or unfortunately, I think the way for us to have the best health is to become our own best expert, to become empowered to say, I understand my gut better now. I understand why I need to get sleep. I understand, why I need to eat this way for my health. This is what my body needs. And honestly, that is a hard earned set of information. But the patients that get that, I hope, feel empowered and feel like they're on this wonderful trajectory for the rest of their lives, that they understand their health and they understand what goes into it. They're going to have better outcomes. They're going to have better outcomes than take a pill and stay on that pill for the rest of your life.
Yeah, I have patients I worked with for several years that you really see that what you're talking about, that they do feel that way. They feel like they have a whole new way of living, and it's natural to them, and you see them have this huge impact on their community. You know,
Yeah.
they they've changed things for their husband and their kids and their friends, and partly I see this because some the friends and the husband stuff start seeing me, but it's that patient and their influence on like the decisions in the family, what they're buying, what's the food, are they drinking out of plastic water bottles, all these kinds of things that um, they have this wonderful ripple effect. And it's because this is now they understand why. And I find
Yeah.
that when people need to do when they're working a program that takes a lot of supplements for a while to fix the different imbalances, I have had patients start with me and sometimes say, like, I've never been good at taking supplements. And I say, I was like that actually also. when I didn't know why I was really taking these things, or if it worked for me. I
Mm-hmm.
heard it was good. So that's not enough. You need to see the labs, understand from the clinical history, with my guidance, why that's important for you.
Yep.
And they never have trouble with it at that point. I mean,
Yeah.
in general. And it's really great, because I think that that's the key, is understanding why they need it. And
It's
that's
so
what you're
such
talking
a
about.
good point. And I think some people don't understand this, and I'm sure that in other places it's false, but I think as physicians, we want you off supplements as much as you do, and we don't want you taking stuff that you don't need to take. I
Never.
sometimes look at lists of supplements and I'm like, oh man, I wish I could cut that down, but this is where your health is at. This is where your body is at. But I really think the bulk of us don't really want you taking stuff that you don't need to be taking. We really want to stick to your goal and your improvement. And we see these successes, so we do use a lot of different tools for that. But
Yeah.
we want to personalize it as much as anyone else.
No, and I always explain to folks, like, well, first of all, you can't supplement your way out of like a bad
Yep.
diet or lifestyle.
Yep.
So that's still the key. We use the supplements to get the change as quickly as we can. We need targeted supplements that are, for example, an antimicrobial herb. Like, we have to kill that overgrowth. We have to use a tool to do that. But these,
Yeah.
I always tell people, this is like a project we're doing. This is not a lifelong thing. This thing right now is a project. We're going to
Yeah.
treat this. Maintenance supplementation when you're healthy is a tiny short list, you
Yep.
know?
Exactly. Tell us, what is the likelihood of someone coming off an antidepressant? I realize that's a giant question, but tell us how you approach coming off of the antidepressant or anti-anxiety medications.
Yeah, I think this is actually really important to talk about, because it's not handled well, I
Yeah.
think, in the conventional model. And part of that is the education. So in my training, I was taught, when somebody's been well from depression, after a certain number of months, you can taper and stop the medication. If they have another episode, then now they have to stay on the medication for the rest of their life.
Yep.
And also, another problem is that when they are tapering the medication, then they often have a relapse of symptoms, and that's seen as indication that they
You
can't
needed
go
it.
without it. They
Yeah.
they, they need it because they're still depressed. When actually, often that is actually a withdrawal symptom, a discontinuation
Yep.
syndrome symptom that is horribly underrecognized with just basic, like, SSRI medications like Prozac or Lexapro,
Mm-hmm.
that this does exist. So this gets back to that topic of neuroplasticity I was talking about earlier, which is that ability of the brain to change and adapt. And what's happened with medications is that the brain is adapted to that medication. It's used to it. And when you take it away, it's got to adjust to coming off of that. If the brain is not flexible, that's going to be really uncomfortable and produce symptoms. But
Mm-hmm.
there's so much we can do to prepare a brain for that change. And this is about making sure that hardware is working well. What's the omega 3s, the magnesium, the B vitamins, what's the level of inflammation. So if we prepare people, and that's
Exactly.
key, then we can talk about tapering. And then we also do it slowly. And one of the things that I think is very important is I work with my patients on how do they feel about this decrease in the dose, because this gets back to that safety in the brain. If they think cutting it in half is too big a leap and is scary,
Mm-hmm.
then we're not going to do it.
Mm-hmm.
Because if that's what their belief is when they take it, the brain is feeling threatened, and
Mm-hmm.
that's going to trigger symptoms. So it's very important to say what feels comfortable as a rate of decrease. Do we need to get it, compounded into some other level of dose that's going to be just a gentle decrease? And of course, there's all kinds of nuances. It depends on what type of medication we're talking about,
Yes.
how we might do that. But I really like to try to get patients to tune into their own feelings around that decrease, and their intuition, because that helps a lot. But first, it's about preparing the brain and really solving the root cause of the depression, and then working with coming off the medication.
Mm-hmm. Thank you for sharing that. I know it's something a lot of people want to do and have
Mhm.
concerns about and feel stuck. And so just to know it's a possibility for a lot of people, it's
Mhm.
so nice to understand.
It is possible for many, many people.
Yeah, yeah, which is wonderful. Okay, as our last question, being a gynecologist and OBGYN, I just can't talk about mental health without bringing it back to postpartum depression because I think it's so underserved. I think that diagnosis is one that we don't understand very well and we don't always treat very well. Will you comment on your experience on it and any thoughts that women should keep in mind if they have a history of postpartum depression or are getting ready to have a baby and watching out for that?
Yeah, I'm so glad you're asking about this. I know when I had my first son, I was very worried about this because my sister had struggled with postpartum depression. And I was very fortunate not to deal with it, but I think it was to do with some steps I had taken. And, just a basic one that comes to mind that I wish everybody would do is making sure their vitamin D level is good.
Mm-hmm.
That's going to help your nursing baby a lot. It's going to help your mood, your whole immune system. But some of the things that happen a lot with postpartum depression, that are just not recognized in conventional medicine. And these would be two key areas. One is the zinc and copper ratio in the body. That's very, very important. And getting that optimized, usually it's people are low in zinc and high in copper. Working with someone who's experienced with fixing that can be a real game changer. And that's not hard to do. And then the other thing is progesterone, I think is a really big one here too. There's even now, an approved treatment that is used conventionally that is based on progesterone for this. Mm-hmm. But we actually have progesterone, bioidentical, which we can be using. Mm-hmm. So, there's a huge drop in progesterone after when you deliver. And for some people, that is just too much for their brain's function, mm-hmm. To not be impacted and to have that mood. And it's safe and easy to use. And so those are the two biggies that I feel like, hey, if we address these, we're going to help a lot of people with their with their postpartum depression. Yeah.
Well, thank you for bringing that up. I think even if nothing else, to have hope. I think sometimes when we have postpartum depression, it's too often dismissed as like, well, postpartum's rough. Like, what are you going to do? And like, if you believe that your brain is not working the way that it should be, trust that.
You're right.
And even if you don't think that even if that's not the case for you, if people around you feel like your brain is not working the way, get help, because there is so much we can do. And it shouldn't just be this, you're a mom now, suck it up and deal with it. There's so much more we can do. So thank you for mentioning 100%.
That. So important.
Well, as we wrap up, is there any last sort of overview or summary statement or any last message that you'd like to give to our women listening?
Just that I really think it's important to recognize that there's a reason that you're having your symptoms. Mm-hmm. There are root causes at play, and those can be uncovered and those can be addressed. And sometimes you can improve them without ever really knowing what they are when you make these lifestyle changes. We talked about these nutrition changes, because then the body can just work better and fix that problem. Yep. So have hope, understand that little baby steps add up, and that's how you make any kind of change. One little baby step at a time. Keep on going. You can feel so much better. There's just so much hope.
Well, thank you for that. Thank you for explaining all of this to us and helping us understand, what we should be looking for. And also then that helps us understand what should be in our toolbox to help people feel better, to help ourselves feel better. So thank you so much for being on. It was such a pleasure to have you here. And it's just such an important topic. I'm so glad we can shed light on it and not feel so hopeless when it comes to mental health disease with anxiety and depression, that it's more of a brain inflammation than really something we should feel bogged down by too much.
That's right. Thank you so much for having me.
Will you tell our listeners where they can find you and how they can work with you?
So my practice can be found at drtracymccarthy.com, and that's for people in California. That's my license, is California license. One of the things I've created for listeners is a guide that's just a great place to start. It's top 10 overlooked causes of anxiety and depression. And you can find that at drtracymccarthy.com/top10. That's TOP10. Mm-hmm. And I really encourage people just to get that, because that's a great place to start. And, if they are interested in more than that, then I have an online program called the Natural Mood Solution, which people can participate in from anywhere. That's an educational program that goes deeper about the things we were talking about today.
Wonderful. What great resources. I'm so happy to share that with our listeners. So thank you again for being here.
My pleasure.
Thank you so much for tuning in to today's episode. A huge thank you to our guest for sharing their insights and time with us. We are grateful for the incredible support from our sponsors and to all of you listening. We couldn't do this without you. If you enjoyed this episode, please consider subscribing on your favorite platform. You can find us on our website, upliftforher.com, YouTube, Apple Podcasts, Spotify, or wherever you love to listen. And if you found value here today, please share this episode with someone who would benefit from it. Leave us a comment or give us a review. It really helps us reach more listeners like you. Thank you for being part of our community. Stay tuned for our next episode. Lastly, this information is for educational purposes only and not intended to be medical advice.